everyone. Thank you for joining us from wherever you are. We know you're busy, and there's a lot of demand on your time, so we really appreciate you making this time for the inaugural webinar of Peace. Peace is a collaboration of 4 diverse institutions. Raising Voices, which is based in Uganda, a premier NGO that has innovated interventions for preventing violence against children in and through schools. University of Cape Town, which has been very influential in policy all over the world. London School of Hygiene and Tropical Medicine, which has done some seminal research on preventing violence against children, and Coalition for Good Schools. We're delighted that you've joined us today, and we have in this webinar planned a really interesting presentations about what we know about scale. We are asking for 1 hour of your time, and we're hoping to divide it into 3 sections. In the first part, we will just tell you a little bit about Peace and who we are. But then the main part will be the presentations about what do we know about scale. And we have 3 really interesting presentations about just models and what we know from evaluations, an example of what it looks like when you're implementing something at scale, and what it takes politically in terms of building relationships and political economy of taking something to scale. And then we'll end with the Q&A and a discussion. So we hope that during that time you will feed in your questions through Q&A part of your screen. But let's begin by just introducing Peace. Peace is a collaborative that stands for Partnership to End Abuse Through Context of Education. And our goal really is to contribute to the conversation that is happening globally. If you're working in the space around preventing violence against children, you will know that there's considerable momentum at the moment in terms of people focusing attention on preventing violence against children. And we want to contribute to that conversation, and we want to broaden and widen the voices that shape the kind of conversation we have. So in many ways, we want to reach out to folks who we don't hear from, particularly folks who are based in Global South, people who are developing interventions and who are working away day in, day out. And we want to kind of elevate their voices and then bring them into conversation as well. We also want to tighten the learning process, that people are doing things on the ground. How can we quickly learn from what they're doing and feed it back into program designs and also in the policy that leads to investments that we make in the work of preventing violence against children? We also want to kind of contribute to widening knowledge and skill around how we do prevention of violence. And we also want to influence how research is done. So the safety, and when we ask children important questions about their experience of violence, what are some of the ethics and what should we be careful of? And what are some of the safety responses we should build in terms of referral? And what is our responsibility when we ask children those questions? So those are some of the places in which Peace hopes to make a contribution to the global conversation. And as I mentioned, that the collaborative work was founded by 4 individuals. And in a minute, I will invite each of them to say a few things. But let me begin from myself. I'm Dipak and I am based at Coalition for Good Schools. We work primarily around focusing attention on preventing violence against children in and through schools. We have a cluster of activities in Asia, run by a partner at Samia Development and Breakthrough. We have a hub of activities in Sub-Saharan Africa, coordinated by Raising Voices. And we have a hub of activities in Latin America as well, coordinated by Aulas Empath. So we have a wide network of partners, all of whom are working on the ground to develop and think about interventions that address the issue of violence against children. Maybe at this point, I'll invite Karen to say a few things about the London School and her involvement.
Thank you, Deepak, and welcome everybody. It's lovely to be here at our inaugural webinar. So my name is Karen Devries. I'm a professor of social epidemiology at the London School of Hygiene and Tropical Medicine. And so I've been working for the past 20 years or so in the field of violence prevention, so focused on violence against women and also violence against children. So much of this time I have spent actually evaluating some of the innovative interventions that Raising Voices and other colleagues have developed to prevent violence against children in schools. And so this is an area I feel really passionate about, and I think we've got huge potential for impact. So as an academic, I'm really interested in kind of helping to build and grow the evidence base around this. And I'm really excited about Peace as an initiative because I really value collaborating with colleagues who do this kind of primary innovation and learning on the ground. So that's me. Thank you.
Thank you, Karen. Prossy?
Thank you, Dipak. Good morning, good afternoon, everyone. I'm very happy to be here. My name is Prossy Jonker Nakanjako. I'm co-director at Raising Voices. We are based in Kampala, Uganda, but our reach and engagement is in over 30 countries globally as Raising Voices, specifically on the Global South. Personally, for over 20 years, my work has focused on building partnerships, influencing policy, and supporting practical evidence-based approaches to violence prevention. Specifically at Raising Voices, we work to prevent violence against women and children. We are 25 years old, and we work alongside communities, schools, governments, like-minded organizations, and other partners that work to prevent violence, to create safe schools, nurturing environments where every child can thrive. As Raising Voices, we are very thrilled to be part of the Peace Initiative. We envision bringing our experience as practitioners, ensuring that evidence is meaningfully integrated into actionable, scalable interventions. Thank you for joining us today, and I hope you find this webinar both insightful and inspiring. Thank you.
Thank you, Prossy. And Shanaaz?
Thank you, Dipak. Good afternoon, good morning, good evening. Absolutely delighted to be here. Dipak, Karen, Prossy, and I have been in conversation for months now and really have reached the stage with this inaugural webinar. It's an achievement. When we first started talking about the idea of peace, it made a lot of sense to me because it's a simple idea, but actually, having worked as a researcher for more than 2 decades, often, your research findings do not really get traction, right? And I think and as researchers, you put a lot of energy into it, but I think it's really important. And I've seen the importance of working side by side with practitioners that evidence-based practices are critical. We need to be integrating not just research into practices, but also how we integrate research into policy is important. As Dipak started off saying, there's been a lot of momentum to end violence against children, but often, it ends in conferences. And what we are really trying to do is to say, how do we keep conversations going, build capacity of both researchers to do the kind of research we're talking about well, but also for practitioners to work together for us to be strengthening our interventions and for us to be able to start talking about really taking programs to scale. And I think that's fundamentally what we're wanting to do, is to form a solid network of like-minded individuals that can take this work, and we can, besides just, meeting at conferences, but being able to take this work forward in a meaningful way. Thank you.
Thank you, Shanaaz. So as you can see, we really hope to develop partnerships with you, collaborations with you, outreach with you, and contribute to how you do your work as well as how we learn from it as well. So in that spirit, today is the first in a series of webinars that we hope to host, helping contribute to the knowledge base and the skill base around how we do violence prevention. And today we are focusing around what do we know about taking ideas to scale. We have 3 really interesting presentations lined up, as I mentioned earlier. The first one will focus on just what we learned from evaluations. And then the second one will focus on an example of an intervention in Pakistan of going to scale. And then the third one will be an intervention in Uganda around how Raising Voices worked with the government of Uganda to take an intervention to scale also. So let me invite Jodie from London School. And perhaps you can start by just introducing yourself.
Thank you, Dipak. Hi, everyone. I'm Jodie Pearlman, and I'm a researcher based at the London School of Hygiene and Tropical Medicine, working in the field of violence prevention with Karen. So I'm going to be taking more of an academic perspective in this presentation. So I'm excited that there are lots of other perspectives in the room. But I'm going to be giving a brief intro of what we actually mean when we say scaling up and the role of evidence when scaling up. And I'm going to share a few preliminary findings from a review we're currently working on, looking globally at school violence prevention programs that have been evaluated at scale. Thanks, Devin. So for an intervention to be helpful and achieve the equitable kind of population level health effects that we want it to, it needs to be delivered at scale. Lots of definitions of scale up exist. The WHO defines scale up as deliberate efforts to increase the impact of successfully tested innovations to benefit more people and foster policy and program development on a lasting basis. So I think the successfully tested bit there is really important because we're talking about interventions that are evidence-based. Next slide, please. So what do we know generally about scaling up interventions and where's the violence prevention field? So generally a lot has focused on health services and a lot of the frameworks that exist around scale up are centered around health services. There is evidence within the education sector. I'd say generally more evidence is around physical activity interventions and nutrition interventions and interventions aimed at improving learning outcomes. But there is a growing evidence base in the violence field. A lot's coming out around parenting programs, which is really exciting. Next slide, please. So why is it important to get evidence on what is working at scale? So traditionally in research, we assume there's this kind of linear process from developing an intervention, piloting it, testing whether it works in a randomized control trial, and then seeing whether it works at scale. So say we've already evaluated an intervention in a randomized control trial, why do we also need to evaluate it at scale? So in terms of school-based interventions, once we scale up an intervention, we're likely to be implementing a kind of wider range of schools in new regions of different types, and it might be that the intervention is not working in the same way in these schools. So we might need to make changes to either the content or the delivery model of an intervention, and evaluating it can help us see whether, firstly, we need to make any adaptations, and secondly, whether any we do make are effective. We often see a decrease in the effectiveness of an intervention at scale, and that's known as a scale-up penalty. And that could be because of adaptations made or the implementation in different types of schools. But evaluating that can help us see kind of what that scale-up penalty is. I think this is all particularly important in the violence prevention field, as the people delivering these programs are really specialists and likely to have views that kind of differ to the prevailing views that might exist in a school or community. So if we make any changes to those people delivering, it might have a really big effect. Next slide, please. So moving on now to a systematic review that we're doing, looking at what's emerging from evaluations of school violence prevention interventions delivered at scale. I'm not going into the full methods of this now, but just to give a flavour of kind of what we're doing and what's coming out. So we've initially looked at kind of all the school violence prevention interventions that have been evaluated in a randomized control trial. So looking at the ones that are evidence-based. So we found a total of 186 trials of school violence prevention interventions globally. And of these 186, we distilled out all the ones that have been evaluated at scale, or where that initial trial was done at scale. So we've only looked at published literature to do this. So I know there's going to be lots of other things going on in this space that won't be captured. So we'd love to hear about them afterwards. Next slide, please. So we found 9 interventions that have been evaluated at scale. So of the 186 trials, 9 of the interventions have been evaluated at scale. 3 in the US, 2 in Canada, and 2 in Uganda, and 1 in each of Finland and Austria. If we think back to that assumed kind of linear process of trial to scale sort of pipeline, we then kind of looked at whether that's happening in reality. So it looks like 5 of the interventions do follow this linear process. So there was an initial trial, the intervention was then scaled up, and another evaluation was done at scale. And from these, we can also have a look at kind of the changes before and after scale up. So we found that 3 of the 5 had adaptations to the content of the intervention and 4 to the delivery model. We also found 4 that do not follow this linear process. So there wasn't a trial kind of before the intervention was delivered at scale. The trial was at kind of the same time point as kind of large scale delivery. So we can see that this kind of timeline and process in reality does vary. Next slide, please. So does it seem like these interventions delivered at scale are working in reducing violence? So on the left, you can see the main result for the 5 interventions where there was a study pre and post scale. So we can see 4 were effective in the initial trial, and 3 of these were also effective at scale. 1 had qualitative data at scale, so we can't really look at effectiveness. And 1 didn't look like it worked in the initial trial. It was scaled up using a different delivery model, but it also didn't work at scale. The 4 on the right show where there was only 1 trial evaluating kind of large scale delivery. And we can see the evidence is slightly mixed. So 1 worked, 2 had more mixed evidence, and 1 didn't show an effect on reducing violence. So it does seem like there is value in getting evidence kind of at both pre and post scale, as it does look a bit more mixed when we go straight to scale without that prior trial. So we're looking a lot more into kind of details on the components, the delivery models, the specific effect sizes, which I haven't shown here, but just to give a kind of flavor of what's coming out. Next slide, please. I think some of my key takeaways, the evidence base is really small. There are many interventions that have been delivered and evaluated at scale. I think an RCT or a trial is really important along the implementation journey at some point to measure effectiveness, but we do also need to study effectiveness at scale. It's also really helpful to have systematic data on the scale-up process and what the journey looks like. For example, the delivery model, the actors involved, the components of interventions, and it's often not that well described in papers. I think what's also coming out is that the linear process we think about from trial to scale up is not that common and is often a lot messier. But where interventions haven't had a prior trial, to me, it seems like there's some sort of policy window opportunity which facilitates this larger rollout despite no prior evidence. But going straight to scale without that prior trial is risky. And the evidence for the effectiveness of interventions which did go straight to scale is a bit more mixed. And if it's ineffective, going to scale, then obviously a lot more money is on the line. But of course, it needs to be balanced with policy opportunities, and that political support is going to be really important for kind of scale up and sustainability of an intervention. So thank you. I'll leave it there. And as I said, we know lots of other things are going on in the space, so I'm looking forward to hearing about your experiences.
Thank you, Jodie. And please keep your questions coming to the Q&A box. Now we'll move to the project from Pakistan, and I invite Maham Khan to talk about the work in Pakistan.
Thank you so much, Dipak. It's a pleasure being here. My name is Maham. I work with Right to Play as education specialist based out of Islamabad in Pakistan. So we're implementing what works to prevent violence against women and girls in Pakistan. So I'll speak a little about what we do and how we are scaling up. So the good thing, and I'll also mention that later as well. So like I mentioned that we are working in Karachi, in schools in Karachi to prevent violence against women and girls. And this is the second part of what works. We first implemented what works 1 in Hyderabad, which is around to us from Karachi. But before I go into that, I just want to quickly, for those who might not be very familiar with Right to Play, it's basically a global organization headquartered out of Canada, and we work all across, we work around 15, 20 countries, and our entire methodology, our ethos, our approach is based around play-based learning. So when we talk about play-based learning, we try to integrate play-based learning into the teaching practices of teachers, of children, and whether we are working on quality education, whether we're working on improving the quality of curriculum standard, it's all basically based around play-based learning. And this is also what we're doing right now when it comes to prevention of violence against women and girls in Pakistan. Next slide, please. So we, of course, work in schools. We work within the school ecosystem. I think you've gone ahead, even the previous slide, please. Yeah, thank you. And of course, I think people who are familiar with Pakistan, they might know that it's a deeply conservative country. It's very, very patriarchal as well. Sadly, violence is very prevalent in Pakistan. But we work specifically with children and school, and we, of course, we work with both primary and secondary school children. But in What Works 2 project, we are working with primary school children from age 11 to 14. And the reason why we have chosen this age group is because this is the time when, children are going through their puberty is starting, their bodies are changing, they are, exploring their bodies, they get influenced by their peers, by their older cousins. And sadly, in Pakistan, more than 50% of females have never attended schools. 90% of women have experienced some kind of domestic violence, whether it's physical, emotional, sexual. Till very recently, there was no law against corporal punishment in Pakistan. Now we do have a law, but even then, of course, children do experience a lot of physical punishment within their schools, and lots of reported cases of child abuse. I think this data is from last year, but this is only the reported cases. The actual number is much more higher, of course. And then when we started working in What Works in Hyderabad, we saw that how our play-based methodology and a gender transformative education in schools can help break violence, cycles of violence, and promote safer, more inclusive learning spaces for children. And this is why then we are scaling towards What Works 2 now that we're working in mostly in Karachi now. Please, next slide, please. So when we talk about scale, so for example, in Hyderabad, when we were working in the first phase of this project, we worked around 20 intervention schools. We're working with more intervention schools. But when we talk about scale, for most, I think, and there's a lot of conversation about scale globally as well. Of course, it is about reaching more schools. It is about reaching more stakeholders. But it is also about integrating effective interventions into the existing system. So Right to Play and our local partner, AHANG, who are the leaders in SRHR when it comes to Pakistan, we do not believe in working in isolation. We have to work within the ecosystem. We have to work within the school system. And this is how we can see that we're going to make a substantial change, hopefully. So I think scale will all when we talk about scale, when we talk about approach, I think it has to be, it doesn't, I think it should not be Right to Play's approach, it shouldn't be AHANG's approach or What Works approach. It has to be integrated into the system and how the system responds to that methodology or approach. So this is about that we want to integrate our systems, our kind of safe, inclusive environment within the school ecosystem. So this is what we mean by scale in our kind of simple language. Next slide, please. So when we were working on this project, and there was a lot of, of course, conversation, discussion around that, are we even ready to scale? What is exactly that does it mean to scale? So we had three main, I think, key pillars that we'd like to talk about. One, of course, I think we were ready in the sense that, so the intention of scale, I think, is mostly there in projects. It, of course, depends on the budget, on the resources, on the human resources as well. But I think three main things that we thought that we're ready to scale now. One, of course, is the readiness of evidence. Through our What Works 1 program, we had very kind of rich evidence showcasing the impact of our work through our intervention that we did in Hyderabad. We saw that through peer victimization had decreased through our intervention, peer bullying had decreased, even domestic violence had decreased as a consequence of that. So we were able to demonstrate that to the government as well, because when we went to the government, because of course when we work in public schools in Karachi, we have to work with the government. So we're able to kind of influence them that, this is the evidence that we have, and our methodology, our approach does work. So we're allowed to kind of work in school. Then, of course, is strong systems and partnerships, both right to play and also, like I mentioned, our local partner, Ahang. We have decades of experience working in Pakistan. Right to play has more than almost 2 decades experience. Ahang has worked in Pakistan for more than 30 years now. So we do have that kind of established relationship with the government. They understand our work. We understand how the government works as well. And we kind of kept on building that relationship with the government, whether it was through district education officers, whether it was through teachers, whether it was through higher management, which was basically the secretary or the education minister. So that really also helped us when we went towards scale. Then, of course, the third one is if whether as an organization we were ready. I think in a very globally rapidly changing environment, we, of course, people are not here forever, they do change. But I think what really helped us was that some of the key people involved in What Works 1, they're also in What Works 2, they still are in What Works 2. So that helped also in the institutional memory, that they kind of helped us, to see what worked well in phase 1, what did not work well in phase 2. So that also really helped us in kind of aligning with the learning model. Ready? Next slide, please. And when we talk about working with government, talk about scaling, I think we also need to understand, like I also mentioned earlier, that we do not believe in working in isolation. We have to work within the school ecosystem. And this is what we work very closely with teachers. We work very closely with school leadership management. We also work with coaches. Now our model is changing. Now we're going towards more teacher-led model than coaches. And then also junior leaders. We would train these young students who can assist their teachers and kind of be the leaders in their own schools as well, because we kind of involve the entire school ecosystem, and that's only then we can kind of hopefully see a important change and all. Next slide, please. I know I'm running a little. Okay, I have time. Okay. So I think when we started working on this project 2.5 years back, many lessons were learned. I'll just talk about 2 main lessons. One, I think the challenge with most of these projects is that they do end at one point. They're not going to last forever. So it's very important to embed continuity and sustainability strategies since the very beginning. This is why when we're working on so we are implementing a play-based life skills education curriculum in the schools in Pakistan, which has been endorsed by the government of Sindh. So once we pull out of this project, once the project ends, they will still have that tool, they'll still have that content to implement that in the schools. And we are training teachers, because these are public school teachers and also private school teachers that we are training. And the hope is that, once we give them the knowledge, the skills, they're going to start implementing that even when the project finishes. And of course, strengthening government ownership, constantly by aligning them with the education curriculum, with the education framework. That's something that's very, very important. And then we also made sure that we also have a formalized MOU with the government of Pakistan as well. And then I think building on that as well, it's very important to build credibility and legitimacy within the government. So constantly, even before we got this project, we're constantly collaborating with the government, inviting them to our events, meeting with them. And this is how we're able to kind of build this buy-in from the government. And the government has many different tiers of hierarchy, of course. One are the field teams, then we have the school management, then we have the higher management. So each kind of person was designated different roles and positions. And yeah, next slide, please. So I'll just repeat what I mean, this is a summary of what I've been saying previously as well. So I think when we talk about mainstreaming and scales, of course, one is involving the government at every step of the way. Secondly, I think it's very important also because, again, in a country like Pakistan, we focus a lot on girls and how they're supposed to. But I think in this project, we also involve boys as well as part of the gender equality. That's also helped us kind of mainstreaming this into the mainstream education framework. And then, of course, providing educators, the teachers, because they are the ones who interact with the students and more. They are the ones who are in schools. So also equipping them with the knowledge, with the tools to make sure that this project does not only end within the time, but also goes beyond that timeline as well. And then, of course, making sure that schools also foster gender-responsive, secure and inclusive learning environment by involving the head teachers, by involving the school management. So it's kind of a whole school approach, like I mentioned. We have different tiers, different kind of hierarchies, and this is how we're also now going towards mainstreaming and scale. I'll stop here. I think I've also over time, but yeah, thank you so much.
Thank you, Maham. We really understand the challenge of trying to summarize such a large body of work in 8 to 10 minutes, but thank you for attempting. Thank you. And of course, people can reach out to Maham if you have questions, or through Q&A if you have any questions for Maham. Now we'll move to Hope Wambi and her work in Uganda. Hope, welcome.
Thank you so much, Dipak, and thank you, colleagues, for having me. Thanks, Jodie and Maham, for really grounding us well around scale coming from research and practice perspective. As already introduced, my name is Hope Wambi. I work with Raising Voices as the Violence Against Student Prevention Coordinator for the global programs. And Raising Voices has been preventing violence against children for over 25 years, and we've been using the Good School Toolkit, an evidence-based methodology that was developed in Uganda, that was piloted in Uganda, tested in Uganda, and has been implemented in Uganda in collaboration with education stakeholders and other partners, including the government. So I'm here to share our experience around scale, or the attempt we have made to collaborate with government and others to make sure that we scale the ideas that are coming from the Good School Toolkit. And as already alluded to, the Good School Toolkit is an evidence-based methodology that a randomized controlled trial revealed that it reduced physical violence perpetrated by adults to learners by 42%, and it also increased the belongingness that children, the attachment that students had to with their schools, as well as reduced peer-to-peer violence. So having seen all those results from the RCT, it gained a lot of traction internally, but also externally. And so I want to share what has been happening over the years. But for starters, as Maham has set us well, we also made a strategic decision to use school as entry point into VAC prevention for the reasons that my colleague already spoke to, that education system interacts with billions of children at any given time, and it also influences their foundations and worldview. And those and many reasons have given us have made us make that strategic decision to invest in schools as entry point. In terms of our experience, right from the onset when we were developing the Good School Toolkit, we were mindful about the fact that it had to land in a context in Uganda for scale to happen. We were developing it for scale, and so we were looking at how sensitive we should be to the local context. We have received a lot of feedback, and even the refinement of the Good School Toolkit, as we later shall see, was informed by several conversations from the key stakeholders who are also the structures mandated to scale this work. For example, the kind of language that we use at that point, there was a lot of backlash towards talking about rights, child rights. And so we adopted a language of a good school because we know every parent and every stakeholder would love their children to go to a good school. Another example is around aligning the intervention to the school calendar so that teachers do not have to carve out extra time for them to do the implementation. So the activities that are outlined within the Good School Toolkit fit well within the school calendar. But also language like intimate pattern of violence, even if when we were adapting to secondary education, we found that there was a lot of IPV. The feedback that we received from some of the advisory body that was put in place, including ministries of education and parents and other stakeholders within the school, there's a lot of pushback around using IPV for students and learners here in Uganda. So we had to adapt to a language of having health relationships to make sure that we can still navigate the context and still do the implementation and have these ideas bought into and scaled. The second thing we did also is to iteratively, rigorously and iteratively adapt this intervention. We started with a good school toolkit that was only implemented in primary schools. And of course, over the years, we learned. When we wanted to scale into secondary schools, we realized that the way violence was manifesting in secondary schools was different. Students in secondary schools, for example, have a lot of power and agency. And so we adapted and had a session on power. How are you using your power? We found that there was a lot of sexual violence in secondary schools. We found there was a lot of bullying. And so we had to make sure that we adapt the content to contextualize it to secondary schools. But along the way, right now, we are having the Good School Toolkit Agile. Again, in response to the so much feedback and our own lessons over the years and collaboration with other research institutions like ID Insight that were helping us to learn from what activities are yielding the most impact in the schools. And if we want to deepen the impact, which activities should we focus on? And having received a lot of feedback around the Good School Toolkit being a bit bulky, we wanted to make a self-help tool that education stakeholders, government, and schools can run with if they wanted to implement the Good School Toolkit. So now we have the GST Agile, which we call a scalable version, which we are implementing and helping other stakeholders also do the implementation. So that trigger was also in regard to the feedback that we had received over the years and also our lessons. Next slide, Devin. Now, in regard to scale, we've learned over the years that if ideas are to be scaled in a context like ours and many others, it's very important that they are endorsed by the key gatekeepers, the key influential people within the education sector in our context. So we had to be intentional with engaging with local government officials, head teachers, teachers' unions, teacher training colleges, journalists, and other civil society organizations to bring them on board in terms of raising awareness, but in terms of getting a training, but also in terms of them appreciating the ideas so that they can be able to scale in their different spaces. And then also around our experience is we were looking at addressing a system because we realized that for change to be permanent, for change to be sustainable, we have to invest in systems. And in this case, which is the education system. So we're looking at the GST being a whole school approach that is engaging everybody in the ecosystem of the child. But beyond the people, it also includes engaging the structures, the culture of the school, the policies within the school, so that everybody is brought on board. But also we had to make sure that we enter into formal memorandums of understanding with government ministries and over 34 local governments in Uganda where the GST is being implemented. We also needed to get certification from the National Curriculum Development Center, and that is something that came through out of long back and forth and dialogue and conversations and reviews. And we have now the National Curriculum Development Center certify the Good School Toolkit. And in Bogota in 2024, we had the GST, the government of Uganda committing to scale and roll out the GST across the country. Next slide. We have learned over the years of the implementation. One of the strong lessons that has come through for us is that you cannot do this alone. Nobody can scale these ideas alone. For an intervention like this and many others, there is need for strong collaboration. And right from this webinar, we have also seen that there is a lot of evidence. Evidence shows us that actually it is possible to prevent violence against children. We have CSOs and other development partners and government and many people out there who have developed programs and ideas and interventions that are actually working. But we cannot do this alone. For example, in a context like ours, we need the government to support with the scale because they have the mandate, they have the infrastructure. When we talk about the curriculum, when we talk about the teacher training institutions, all that is within the powers of the government. So it's very important that we as all stakeholders who are working in the ecosystem are working collaboratively to ensure that these ideas go to scale. And then lastly, we also learned over the years that it's very important to invest in building relationships with key decision makers. Of course, recognizing what governments can do and what they cannot do. We cannot develop an intervention like the GST and just throw it at the government and expect that they will do the scale. But we as for example, the developers of the initiators of the ideas in collaboration with the government, we can play a role of being protagonists. In our case, we are providing technical assistance to colleagues who are doing the implementation. But even in cases where the government has adapted some of our content, some of the ideas, we are still playing that protagonist role to ensure that it lands. So it's very important that we appreciate what government can do, what CSCOs can do, who are the protagonists, and how can they all work together towards scaling the ideas like the ones that we have to prevent all forms of violence against children. Next slide. Thank you so much. That was my last slide. Thank you so much for your time. That's what I can share for now, but I'm happy to respond to any questions later on. Thank you. Back to you, Dipak.
Thank you, Hope. Thank you, Hope. So there you are. You had 3 presentations producing, we hope, some ideas for you to engage in. Clearly, there are large bodies of work that have been summarized in this 8-minute format, and we would like to host a discussion. And to host that discussion, I'd like to invite Shanaaz next to in some ways take the discussion forward, and invite all the participants to send your questions through Q&A. Shanaaz, over to you.
Thank you. Thank you, Dipak, and excellent presentations from every presenter. Jodie started us off with discussing her systematic review. We had Maham talking about how they're scaling the right to play in Pakistan, and Hope also, discussed how the Good School Toolkit in Uganda is being scaled. So really taking research and then going into practice and how it's happening in practice. What I'm going to do, and Dipak, you have been encouraging our participants to put into the chat some questions into the Q&A, but in preparation for that, I've also come prepared with some questions. And I'm going to go in the order that you've presented in. So Jodie, first question to you, and really interesting because you've looked at this body of evidence around, RCTs and what programs have been scaled, coming out with only 9 programs. From digging into those programs, what are you seeing are some of the challenges in getting models ready for scale and moving from this rigorously tested through RCTs, small scale models, taking it to scale with fidelity and then maintaining impact? Because we certainly see that some of the interventions, although they through RCTs had shown effect, didn't show effect once it's scaled. From your perspective, what do you think are some of those challenges that you face in the real world?
Thank you. Yeah, I think it's a really interesting question. I think one of the big challenges is kind of the general lack of evidence and learnings from other programs. I mean, yeah, we saw only 9, and only like 4 of those didn't have that kind of initial systematic recording of their like scale up process. And I think often we know a lot is happening in the real world, but I think it's just not systematically documented. So we know we need to make kind of adaptations to these interventions, but we're not sure kind of what they are or like whether they'll actually work. And I think without kind of that evidence kind of before and after, we're not really sure about the effects of changing certain components or certain ways of delivering. I think actually evaluating something at scale is also kind of presents its own challenges. Like it's not always feasible to do a really rigorous large-scale randomized controlled trial kind of logistically or financially. So I think there are lots of other methods out there, but I think that kind of brings about a whole nother set of challenges around kind of actually understanding whether we know if something works at scale.
Thanks, Jodie. So what you're highlighting is also some of the challenges of evaluating programs at scale, but also the importance of documenting as adaptations are made along the way. So turning to Maham, you've been working at Right to Play. You've adapted Right to Play to take it to scale. So just, the question to you, Maham, and, in your experience, integrating your work, Right to Play's work, into government, the education system in Pakistan, and making the necessary adaptations, what are some of the challenges that you've experienced in doing that and engaging in that process?
Thank you, Dr. Shanaaz. I think the challenges are many, many challenges. I think, like I mentioned earlier as well, that working in a very patriarchal country like Pakistan, it's not easy. Working with the government, of course, it's not easy, and especially working on gender topics are I think so. We of course had the evidence from What Works One, which was a huge benefit for us. But I think it was also to convince the government that it's please let us implement this curriculum in the schools basically. So I remember when we went. So as per the policy of the government of Sindh, any content that's being implemented in schools in Sindh, we have to get it approved by the government of Sindh, basically by their Teachers Development Authority. So when we went to the government to get it approved, they said that everything is okay, but why don't you remove the word puberty from the content? So we were like, that is the entire program. You cannot remove the word puberty, of course. But then what we did was that we kind of listened to them and we said that we're not going to remove the word puberty, but we can do separate sessions for girls and boys in their classroom. And that was really, I think, that really helping. So that was the biggest, I think, challenge to get buy-in from the government on this. And I think it really helped that because Right to Play, of course, is the leader when it comes to social emotional life skills. And then our local partner, the leaders when it comes to SRH, convince the government that it's okay to implement such content within the school systems as well. I think we've been quite successful in doing that. So yeah.
Thank you, Maham. I see our Q&A is quite active, but before we move to the Q&A section, maybe over to Hope. And I think, Hope, I can see a lot of synergy between what, your experience in Uganda as well as the experience in Pakistan. But I'm going to deviate a little bit from the question I had initially thought of. And as you were talking, in your experience in Uganda, there's obviously multiple pathways to scale interventions. You've taken the pathway to scale, and it makes sense to work through the education system. So do you want to talk a little bit about, the kind of pathway to scale that you've taken?
Thank you so much, Shanaaz. And I'll speak about three things. I'll emphasize three main things. One is in our experience, when we look at scale, one thing that stands out is we need to have the technical resource. So in Uganda, what we have done as Raising Voices is we have an infrastructure a structure that we call the regional resource persons. Regional resource persons are teachers, head teachers, or education officers, or inspectors of schools who have experienced the Good School Toolkit through implementation, and they are building the capacity of the schools and providing TA to the schools within their respective districts. So we have 42 regional resource persons that spread out across the 34 districts in Uganda and who are on a daily providing the implementation and the support where we are not as Raising Voices. And because they are in the education system, they interact with the schools on a daily, because each regional resource person has close between 16 and 20 schools. And that is also helping in regard to scale. The second idea is the need to collaborate with the government when it comes to scale. As I have shared in our context, we've had, for example, some of the concepts around positive discipline have been adapted and taken as a policy issue with the government, and they are being rolled out because they are responding to a need. After the government of Uganda, for example, banned corporal punishment, teachers were saying, what can we use? So the Good School Toolkit came in with this idea, which was like a response to a problem. So this collaboration has, ensured that, there are concepts that have been taken on, but also the certification by NCDC is something that has come out of this collaboration and engagement. And now with the commitment from Bogota, what is left for us to do, which we have already started, is engaging to see how these ideas can make their way through the curriculum, and so that they are rolled out with the leadership of the government. So that's the second thing. The last thing I would like to say is that our Good School Toolkit is open source. Any partner, anybody can go to the website and pick it up, and they do implementation. So it is also important to mobilize other civil society organizations and other stakeholders within the ecosystem who are passionate about this issue and provide the support for them to be able to scale the ideas. So that is the third thing that we are doing, and we are also seeing as being effective. So 3 things: technical expertise, government collaboration, and mobilizing others to be part of the cause. Thank you. Back to you.
Thank you, Hope, Maham, and Jodie. Now we're going to turn to our questions from our participants. And I'm not sure if you've answered any of those in the chat, but the first question was for Jodie. And it's coming from Manjir, and Manjir's asking, did any of the RCTs measure the reduction of child sexual abuse at scale? Can you answer that?
Yeah, thank you for the question. So there was actually quite a range of violence outcomes that were looked at scale. So there were quite a range of interventions in terms of what they intended to reduce. It looks like only one measured a kind of sexual abuse related outcome, but it was actually looking at knowledge of sexual abuse, which is quite common because it's so hard to measure kind of sexual abuse in a trial. So yeah, only one looked at kind of knowledge. That was, I think, the only sexual abuse related outcome. And yeah, we don't always see kind of exactly the same outcomes measured at scale compared to the original trial, which is sometimes fine because it can still give us kind of an indication of whether something's working. But yeah, that was the only one for now that I found.
Okay, there are quite a few questions for you, Jodie, and I'm not going to pose all your questions. So maybe if you want to have a look at some of them and respond to it in the chat. Next question, Hope, there's a question to you. How have you handled evidence-based advocacy with governments, given that government decision-making is informed by several other factors beyond just the research evidence? And I think, Jodie, you mentioned it, that, often interventions are taken to scale because it's policy priorities. There's something else happening, and it's not about the evidence. So, Hope, do you want to come in here?
Thank you so much. I think, like I have alluded to, the kind of collaboration we've had with government, especially with the Ministry of Education here in Uganda and Ministry of Gender, has taken a very long time. In terms of us, for example, being part of the different structures, the policy structures that have been convened by the government, for example, raising voices, being part of the technical groups like the Basic Education Working Group, that is talking about, convened by the government, but speaking about the key issues that affect learners in primary education, being part of the Secondary Education Working Group, being part of the Gender Technical Working Group, being part of the Interministerial Committee on Violence Against Children at the country level. The fact that these spaces are mandated and are convened by the government, it means that when we are part of that space and we are part of the team that is influencing the conversations at that level, it is easier because it's demand driven and there's already a need. I alluded to, for example, the positive discipline, whereby the government had, for example, banned corporal punishment. And there was already a need. Teachers were saying, if you don't want us to use corporal punishment, then what should we use? It's the only thing we know. And then this is when Raising Voices comes in and sits with government and says, but you know what? There is actually positive discipline. So for some of those, it's easier because there's already a landing, there's already a need which is created. And so the government is reaching out. There are instances when they are actually reaching out. For example, they reached out recently to Raising Voices and a coalition of other organizations that we came together to form a coalition on positive discipline. And they were telling us, could you please revisit, support us in terms of reviewing the alternatives to corporal punishment? So those being part of those decision-making spaces has also supported us in terms of influencing the discourse and the conversation. But also maybe before I leave, Shanaaz, I know we're out of time, also collaborating with other organizations and coming together to advocate towards a specific cause is something that has helped in our context, that it's not Raising Voices that is pushing for these ideas. It's a collective of other partners, and some of the protagonists are actually allies within the government who have also been bought into these ideas and they want to see them go to scale. So those are just two areas that I can mention.
Okay, there are lots of questions in the chat, and I'm wondering, we're running out of time. We've got 4 minutes left, Dipak, but there's a really important question in here for Jodie. And the question is really, what lessons from practice-based learning will also be considered as evidence for an intervention, or does it have to be an RCT? A tough question that always comes up. And I think it's really important to briefly address, and maybe that's something we've got to consider at another webinar, is to just have what is evidence and how do you use evidence. So Jodie, maybe you will give a stab at this.
Yeah, I think I can start, but I think Hope and Maham can definitely add. I think it's so important, practice-based learning. Like, we can learn so much from it, and I think it just answers a slightly different question. So an RCT can give us kind of a quantitative measure of effectiveness, which is just one kind of research question we're asking at scale. But yeah, practice-based learning gives us completely different answers. And I think there's so many ways of documenting what's working at scale and what's feasible, and that scale-up process where I think practice-based learning comes in as very important. So yeah, I think it's definitely a really useful and necessary way of learning.
That was a researcher answering.
Yeah.
So Maham, your take on it? Do you want to give a stab at answering the question?
No, thank you so much, Dr. Shanaaz. So I think we are already doing practice-based learning quite a bit in what works too as well. And that, of course, is I think that's where the real lessons come from, because we're also doing RCT as well in us. So I think it's very important to also answer a question that can government implement this at scale? What adaptations are needed across different contexts? So of course, I think that's very, very important, which we're already hopefully doing as well. And we are integrating that learning into our own work as well. So yeah.
I know we're pretty much out of time, but thank you for our 3 panelists and for indulging me in asking you these tough questions. But we could probably have gone on all afternoon. It's such an interesting area of conversation. Dipak, I'm going to hand back to you.
Thank you, Shanaaz, and fascinating conversation. And we could have continued for another hour, maybe even longer. And that's the intentions of these webinars, is to start a conversation. And we have others coming in this series. Yeah. So for example, the next one, we want to talk a little bit about how to bring education sector on board to own this problem of violence prevention, right? And so do interventions for preventing violence against children in schools have any impact on learning outcomes, and how to think about the connections between the two. Those are some of the questions we want to address. What is practice-based learning? It's words we throw around, but it's something that we could discuss. Yeah. And then this whole idea about relationship building and using evidence to persuade is another area which we would want to explore. So there are many questions, and we invite you all to get involved in the conversation. You will receive an email thanking you for participating and making sure that you remain connected with what is coming next. Of course, you will have an option to opt out if you don't want to receive those emails, but we hope you'll remain in connection. But once again, thank you so much for the panelists for making the time and really interesting presentations. Thank you to all the co-founders, and thank you to all the people who took the time to join us today. And we hope you will join us in our next webinar as well, and you will receive details of that through email. Thank you, everyone.
Thank you.
Thank you, everyone.
Thank you,
Thanks, everyone. See you
We
next
didn't
time.
answer all the questions in the chat. I'm feeling bad, really bad about that, but that's how it goes.
Yeah, that's always the challenge. That's always the challenge. All right, guys, take care.
Yes. Well done,
Bye,
everyone.
everyone.
Bye.
Thank you. Bye-bye.
Well done, everyone. Thank you so much.
Thank you. Bye.
Enjoy the last of your holiday. Bye, and enjoy the retreat. Have a great week.
Thank you, Devin.
Right. Signing off. Bye, everyone.
About 10 participants still signed in. Should we just end it? Carol? Carol?
Hi, Prossy.
Maybe you just end the webinar. I think there are some participants still signed online. So
Let me
let's
run to the
just
server
end
room.
it.
Sorry, I was in the media room. Let me just end it from here.
Thank you very much.